Hi, I'm Glenn Melancon. Earlier, I made a presentation to the Democratic women of Grayson County called What's at Stake? Looking at potential changes to health insurance programs. Now we know more precisely what's at stake. House Republicans just released their replacement for the Affordable Care Act. What's in TrumpCare? What do we lose with TrumpCare? What's the bottom line? The Congressional Budget Office predicts that 24 million Americans would lose insurance under TrumpCare. The uninsured rate would rise from the current 10% back to the pre-ACA rate of 16% or higher. How does that happen? One of the major problems with TrumpCare is how it treats pre-existing conditions. It claims that it eliminates the individual mandate, but does it? TrumpCare allows private corporations to punish individuals without insurance when they choose to buy coverage. Corporations would charge a 30% higher premium as a penalty for anyone who did not have coverage. That means a $3,000 penalty on $10,000 worth of insurance. That penalty would be a huge barrier for average Americans to buy insurance. What happens to the coverage requirements created by the Affordable Care Act? Obamacare regulations on private plans would remain the same. States, however, want flexibility. TrumpCare allows state Medicaid programs to drop essential benefits like maternity coverage, prescription drug coverage, and mental health care coverage. You need to remember that 50% of all American mothers use Medicaid to pay for their newborns. Medicaid pays for seniors to buy the medicines they need to stay alive. Mental health care programs treat our neighbors as patients rather than criminals. What happens to the cost of insurance? The Obamacare tax credits based on income go away. They are replaced with tax credits based on age. What's the practical difference? For a person over age 55, the cost would be $4,000 higher. For someone under 35, however, they would be $2,000 lower. These TrumpCare tax credits don't really make private insurance affordable. They aren't big enough for most families. Younger, healthier people would drop out of the system. Healthcare inflation would accelerate, hurting every American with employee-based insurance. Obamacare also expanded eligibility for Medicaid. Before the Affordable Care Act, eligibility was set at $14,000 a year for a family of 4. After Obamacare, a family of 4 earning $34,000 a year could receive coverage. TrumpCare stops Medicaid expansion. There would be no new enrollees. TrumpCare caps payments to the states. Over time, this erodes the purchasing power of Medicaid enrollees. TrumpCare effectively rations care by cutting funding to the states. This change shifts the blame for the cuts from the President and the Congress to the states. Overall, TrumpCare is a very bad deal for your family. Millions of Americans would lose insurance. The uninsured rate would return to the pre-Obamacare rate. If you agree with me, please call your representative in Washington. Let your voice be heard. Together, we can make a more perfect union.